The relentless march of technology has always held profound implications for the human experience. From the advent of the wheel to the invention of the internet, each technological leap has reshaped our world in ways both profound and unforeseen. Today, we stand on the precipice of another such transformation, driven by the rise of artificial intelligence. This transformative technology, with its ability to mimic human intelligence and automate complex tasks, is poised to revolutionize countless industries, and healthcare is no exception. The healthcare industry, long considered a bastion of human expertise and empathy, is now rapidly embracing the potential of AI. Faced with an aging population, rising healthcare costs, and the increasing prevalence of chronic diseases, healthcare systems around the world are turning to AI for solutions. AI algorithms, with their ability to analyze vast amounts of data and identify patterns that elude human observation, offer the tantalizing promise of earlier diagnoses, more effective treatments, and ultimately, a healthier future for all. The integration of AI into healthcare is not without its challenges. Concerns about data privacy, algorithmic bias, and the potential displacement of healthcare workers loom large. As AI systems become increasingly sophisticated and autonomous, questions arise about the ethical implications of their use in life-or-death medical decisions. Striking a balance between harnessing the power of AI and preserving the human touch in healthcare will be one of the defining challenges of the 21st century. This documentary embarks on a journey to explore the evolving landscape of AI in healthcare, examining both its extraordinary potential and the complex challenges it presents. By delving into the current applications of AI, the projected advancements in the near future, and the profound ethical considerations that must guide its development and deployment, this film aims to shed light on the question that is on the minds of patients and healthcare providers alike. Will AI replace human doctors? The healthcare industry is undergoing a profound digital transformation, fueled by the exponential growth of data and the rapid advancements in AI. Every aspect of healthcare, from diagnosis and treatment to patient care and administrative processes, is being touched by the transformative power of AI. This digital revolution is not merely about adopting new technologies, it represents a fundamental shift in how healthcare is delivered, managed, and experienced. At the heart of this transformation lies the unprecedented availability of healthcare data. Electronic health records, medical imaging, genomic sequencing, and wearable health trackers are generating a deluge of data that holds invaluable insights into human health. AI algorithms, with their ability to sift through this vast sea of information, are uniquely positioned to unlock these insights and transform them into actionable knowledge. The initial wave of AI adoption in healthcare has focused on automating routine tasks and augmenting human capabilities. AI-powered systems are now being used to transcribe medical notes, analyze medical images, assist with surgical procedures, and even provide personalized health recommendations. These early applications have demonstrated the potential of AI to improve efficiency, reduce errors, and enhance the quality of care. However, the true transformative power of AI in healthcare lies in its ability to go beyond automation and into the realm of prediction and prevention. By analyzing patterns in large datasets, AI algorithms can identify individuals at risk of developing certain diseases, predict the likelihood of treatment success, and even suggest personalized interventions to prevent adverse health outcomes. This predictive power of AI has the potential to shift the paradigm of healthcare from reactive to proactive, from treatment to prevention. The rapid advancements in AI have sparked both excitement and apprehension, particularly in the context of healthcare. On one hand, AI holds the promise of revolutionizing healthcare delivery, making it more accessible, affordable, and effective. On the other hand, the prospect of machines playing a greater role in healthcare raises concerns about job displacement, algorithmic bias, and the potential erosion of the human touch in medicine. Proponents of AI in healthcare highlight its potential to address some of the most pressing challenges facing the industry today. They argue that AI can help alleviate physician burnout by automating routine tasks, reduce diagnostic errors by providing objective insights, and improve patient outcomes by enabling personalized treatments. Moreover, AI-powered telehealth platforms have the potential to extend the reach of healthcare to underserved populations in remote areas. However, the integration of AI into healthcare is not without its critics. Concerns have been raised about the potential for AI systems to perpetuate existing biases in healthcare data, leading to disparities in diagnosis and treatment. Others worry that an over-reliance on AI could erode the human element of healthcare, leading to a decline in empathy and compassion in patient interactions. The debate surrounding AI in healthcare is complex and multifaceted, with valid arguments on both sides. As we stand on the cusp of a new era in medicine, it is crucial to approach the integration of AI with a balanced perspective, carefully weighing its potential benefits against the potential risks. The question is not whether AI will transform healthcare, but how we can harness its power responsibly and ethically to create a future where technology and human expertise work in harmony. The key lies in finding the right balance, a delicate equilibrium where AI augments human capabilities without replacing the essential qualities that make us human. Achieving this equilibrium requires a multi-pronged approach. First and foremost, it is essential to prioritize ethical considerations in the development and deployment of AI in healthcare. This includes addressing concerns about data privacy, algorithmic bias, and transparency in decision-making. Robust regulatory frameworks are needed to ensure that AI systems are developed and used responsibly, with appropriate safeguards in place. Equally important is the need to foster a culture of collaboration and trust between healthcare professionals and AI developers. This requires open dialogue, shared understanding, and a willingness to learn from each other. Healthcare professionals must be actively involved in the design and implementation of AI systems to ensure that they are aligned with clinical workflows and patient needs. Ultimately, the success of AI in healthcare will depend on our ability to embrace its potential while remaining mindful of its limitations. By approaching this transformative technology with a spirit of collaboration, ethical awareness, and a deep commitment to patient well-being, we can shape a future where AI empowers healthcare professionals to deliver more effective, compassionate, and human-centered care. In the bustling corridors of modern hospitals and clinics, a silent revolution is underway. Artificial intelligence, once relegated to the realm of science fiction, is now an integral part of the healthcare ecosystem, silently streamlining operations and enhancing patient care in ways both subtle and profound. From the moment a patient schedules an appointment to the analysis of their medical records, AI algorithms are working behind the scenes, optimizing workflows and improving efficiency. One of the most immediate impacts of AI in healthcare has been in the realm of administrative tasks. AI-powered systems are now being used to automate a wide range of administrative functions, such as appointment scheduling, billing and coding, and insurance claims processing. This not only frees up valuable time for healthcare professionals to focus on patient care, but also reduces the likelihood of errors and improves the overall efficiency of healthcare operations. AI is also transforming the way medical records are managed and analyzed. Natural language processing, a branch of AI that enables computers to understand and interpret human language, is being used to extract meaningful insights from unstructured medical texts, such as doctor's notes, discharge summaries, and pathology reports. This allows healthcare providers to quickly access relevant information, identify potential risks, and make more informed decisions. Furthermore, AI-powered chatbots and virtual assistants are being deployed to improve patient engagement and communication. These intelligent systems can answer frequently asked questions, provide personalized health information, and even assist with medication reminders, reducing the burden on healthcare staff and empowering patients to take a more proactive role in their own health. The human eye, for all its wonders, is not without its limitations. In the realm of medicine, where the difference between a timely diagnosis and a missed opportunity can be life-altering, the ability to see beyond the visible is paramount. This is where artificial intelligence is proving to be an invaluable ally, augmenting human perception and revolutionizing the field of medical imaging and diagnostics. AI algorithms, trained on vast datasets of medical images, are now capable of detecting subtle patterns and anomalies that might escape even the most experienced radiologists. From identifying early signs of cancer in mammograms to detecting minute fractures in X-rays, AI is enhancing the accuracy and speed of diagnosis, leading to earlier interventions and improved patient outcomes. The applications of AI in medical imaging extend far beyond radiology. In ophthalmology, AI algorithms are being used to diagnose diabetic retinopathy, a leading cause of blindness, with remarkable accuracy. In dermatology, AI is assisting in the diagnosis of skin cancers, improving the accuracy of early detection and reducing unnecessary biopsies. Moreover, AI is not limited to static images. In cardiology, AI algorithms are analyzing electrocardiograms to detect irregular heart rhythms and predict the likelihood of heart attacks. In neurology, AI is being used to analyze brain scans to diagnose strokes, Alzheimer's disease, and other neurological disorders. As AI continues to evolve, its ability to unveil the invisible world within the human body will undoubtedly transform the landscape of medical diagnostics. The operating room, once the exclusive domain of skilled surgeons wielding scalpels with precision, is undergoing a technological renaissance. Artificial intelligence, in conjunction with advances in robotics, is transforming the surgical landscape, ushering in an era of minimally invasive procedures, enhanced precision, and faster recovery times. Surgical robots, guided by AI algorithms, are now assisting surgeons in performing a wide range of complex procedures, from delicate heart surgeries to minimally invasive prostate removals. These robotic systems, with their multiple arms and high-definition cameras, provide surgeons with enhanced dexterity, greater precision, and a magnified view of the surgical field, allowing for more accurate and less invasive interventions. AI is not merely augmenting the capabilities of surgeons during surgery, it is also playing a crucial role in pre-operative planning and post-operative care. AI algorithms can analyze medical images, such as CT scans and MRIs, to create three-dimensional models of the patient's anatomy, allowing surgeons to plan the optimal surgical approach and anticipate potential challenges. In the post-operative period, AI-powered systems can monitor patients' vital signs, track their recovery progress, and even alert healthcare providers to potential complications. This not only improves patient safety, but also allows for earlier discharge and reduces the burden on healthcare systems. The quest for new drugs and therapies is a long and arduous journey, often fraught with setbacks and dead ends. Traditional drug discovery methods, while effective, can be time-consuming and exorbitantly expensive. Enter artificial intelligence, a powerful new tool in the arsenal of pharmaceutical companies, poised to revolutionize the way we discover and develop new medicines. AI algorithms, with their ability to analyze vast datasets of molecular structures, biological pathways, and clinical trial data, are accelerating the drug discovery process in unprecedented ways. AI can sift through millions of potential drug candidates, identifying those with the highest likelihood of success and eliminating those likely to fail, significantly reducing the time and cost associated with bringing new drugs to market. One of the most promising applications of AI in drug discovery is in the field of personalized medicine. By analyzing a patient's genetic makeup, medical history, and lifestyle factors, AI algorithms can predict how they are likely to respond to a particular drug or treatment, paving the way for tailored therapies that are more effective and have fewer side effects. Furthermore, AI is being used to repurpose existing drugs for new indications. By analyzing large datasets of clinical trial data and scientific literature, AI algorithms can identify potential new uses for existing drugs, potentially offering faster and more cost-effective solutions for unmet medical needs. The traditional model of healthcare, where patients travel to hospitals and clinics for consultations and treatments, is gradually giving way to a more distributed and patient-centric approach. Telehealth, the use of technology to deliver healthcare remotely, is rapidly gaining traction, and artificial intelligence is playing a pivotal role in its evolution. AI-powered telehealth platforms are making it possible for patients to consult with healthcare providers from the comfort of their own homes, regardless of their geographical location. These platforms utilize video conferencing, remote patient monitoring devices, and AI-powered symptom checkers to provide virtual consultations, diagnose common ailments, and even manage chronic conditions remotely. AI is also transforming the way chronic diseases are managed. Wearable health trackers such as smartwatches and fitness bands are collecting a wealth of data on patients' vital signs, activity levels, and sleep patterns. AI algorithms can analyze this data to track patients' progress, identify potential health risks, and alert healthcare providers to early signs of deterioration. This real-time monitoring and early intervention can help prevent hospital readmissions, reduce healthcare costs, and improve patients' quality of life. As AI continues to advance, telehealth platforms are expected to become even more sophisticated, offering a wider range of services and transforming the way healthcare is delivered in the 21st century. The concept of personalized medicine, where medical treatments are tailored to each individual's unique genetic makeup, lifestyle, and environmental factors, has long been a tantalizing goal for healthcare providers. Artificial intelligence, with its ability to analyze vast amounts of data and identify complex patterns, is bringing this vision of personalized healthcare closer to reality. AI algorithms are now being used to develop personalized treatment plans for a wide range of diseases, from cancer to diabetes to heart disease. By analyzing a patient's genetic information, medical history, lifestyle factors, and even their social determinants of health, AI can predict how they are likely to respond to different treatment options, allowing for more targeted and effective interventions. Furthermore, AI is playing an increasingly important role in predictive analytics, identifying individuals who are at risk of developing certain diseases before they even show symptoms. By analyzing large data sets of electronic health records, genetic information, and lifestyle factors, AI algorithms can identify patterns and risk factors that might not be apparent to human observers. This early identification of at-risk individuals allows for preventative measures to be taken, potentially delaying or even preventing the onset of disease. As AI continues to evolve, its ability to personalize healthcare and predict future health outcomes will undoubtedly revolutionize the way we approach health and wellness in the years to come. Imagine a world where diseases are predicted before they manifest, where interventions are tailored to individual risk profiles, and where healthcare shifts from reactive treatment to proactive prevention. This is the promise of predictive analytics in medicine, a field rapidly advancing thanks to the power of artificial intelligence. By harnessing the vast and ever-growing sea of healthcare data, AI algorithms are unlocking the ability to anticipate health outcomes with remarkable accuracy, ushering in a new era of personalized and preventative care. At the heart of this revolution lies the ability of AI to identify complex patterns and correlations within massive datasets that would be impossible for humans to process. Electronic health records, genomic data, lifestyle information, and even environmental factors can be analyzed holistically to create comprehensive patient profiles. These profiles, constantly updated and refined, provide insights into an individual's susceptibility to certain diseases, potential drug interactions, and even their likely response to specific treatments. Consider the impact on chronic disease management. By analyzing historical data, AI algorithms can identify individuals at high risk of developing conditions like diabetes, heart disease, or certain types of cancer. This allows for early interventions, lifestyle modifications, and personalized screening programs, potentially delaying or even preventing the onset of these debilitating diseases. The implications extend beyond individual patients. Predictive analytics can be applied on a population level to forecast disease outbreaks, identify public health trends, and optimize resource allocation within healthcare systems. This proactive approach can help manage resources more efficiently, prepare for potential health crises, and ultimately improve the overall well-being of communities. The traditional one-size-fits-all approach to medicine, while well-intentioned, often falls short of addressing the unique needs of each patient. Every individual possesses a distinct genetic makeup, medical history, lifestyle, and set of environmental exposures that influence their health outcomes. Personalized medicine, empowered by AI, seeks to bridge this gap by tailoring treatments and interventions to the specific characteristics of each individual. AI algorithms excel at identifying subtle correlations between a patient's unique profile and their likely response to different treatment options. In the field of oncology, for example, AI is being used to analyze tumor genetics, predict the aggressiveness of cancer cells, and personalize chemotherapy regimens to minimize side effects and maximize effectiveness. This targeted approach moves away from the trial-and-error methods of the past, leading to more precise and effective cancer treatments. The realm of pharmacogenomics, the study of how genes affect a person's response to drugs, is another area where AI shines. By analyzing a patient's genetic profile, AI can predict their likelihood of experiencing adverse drug reactions, identify the most effective medications for their specific condition, and even determine the optimal dosage for optimal therapeutic benefit. This shift towards personalized medicine extends beyond drug treatments. AI-powered tools can analyze a patient's lifestyle factors such as diet, exercise habits, and sleep patterns to develop personalized recommendations for improving their overall well-being. This holistic approach empowers patients to take a more proactive role in managing their health, leading to better long-term outcomes. The transformative potential of predictive analytics and personalized medicine in healthcare is undeniable. However, with great power comes great responsibility. As we venture further into the realm of AI-driven healthcare, we must tread carefully, ensuring that ethical considerations remain at the forefront of innovation. Striking a balance between leveraging the power of data to improve health outcomes and safeguarding patient privacy and autonomy is paramount. The vast amounts of data required for AI algorithms to function effectively raise concerns about data security and patient confidentiality. Robust data encryption methods, secure storage systems, and strict access controls are crucial to prevent data breaches and protect sensitive patient information. Transparency in data usage is also essential. Patients must be fully informed about how their data is being used, who has access to it, and for what purposes. Another ethical consideration is the potential for algorithmic bias. AI algorithms are only as good as the data they are trained on. If the training data reflects existing biases in healthcare, such as racial or socioeconomic disparities, the resulting algorithms may perpetuate or even exacerbate these inequalities. It is crucial to ensure that training datasets are diverse and representative of the populations they are intended to serve, and that algorithms are regularly audited for bias. The increasing use of AI in healthcare also raises questions about patient autonomy and the doctor-patient relationship. While AI can provide valuable insights and recommendations, the final decision-making power must always rest with the patient and their healthcare provider. Open communication, shared decision-making, and a focus on patient values and preferences are essential to ensure that AI tools empower rather than overrule human judgment. The integration of AI into healthcare is not merely about technological advancement, It represents a fundamental shift in the paradigm of healthcare delivery. By harnessing the power of predictive analytics and personalized medicine, we are moving towards a future of proactive, preventative, and patient-centered care. Imagine a world where individuals have access to personalized health dashboards, providing them with real-time insights into their risk factors, early warning signs of disease, and tailored recommendations for maintaining their well-being. Empowered by this knowledge, patients can take a more proactive role in managing their health, making informed decisions about their lifestyle, and seeking early interventions when necessary. This shift towards patient empowerment also has the potential to transform the doctor-patient relationship. Freed from the burden of repetitive tasks and data analysis, healthcare providers can devote more time to building meaningful relationships with their patients, providing empathy and support, and focusing on the human aspects of care that are essential for healing and well-being. The journey towards this future of proactive healthcare is ongoing, and challenges remain. However, by embracing the transformative potential of AI while remaining vigilant about ethical considerations, we can create a healthcare system that is not only more effective and efficient, but also more humane, equitable, and responsive to the needs of all. The human eye, for all its remarkable capabilities, has its limitations. Even the most skilled physician, peering intently at a medical image, can miss subtle details or struggle to interpret complex patterns. This is where artificial intelligence is stepping in, not to replace human expertise, but to augment it, acting as a powerful new lens through which we can view the inner workings of the human body. In the realm of medical imaging, AI is emerging as a game changer, enhancing our ability to detect, diagnose, and monitor a wide range of diseases with unprecedented accuracy and speed. AI algorithms, trained on vast datasets of medical images labeled by experienced radiologists and pathologists, are learning to recognize subtle patterns and anomalies that might escape even the most discerning human eye. These algorithms can analyze images from a variety of modalities, including X-rays, kinetic scans, MRI scans, and ultrasound images, identifying subtle variations in tissue density, blood flow, and other physiological indicators that can signal the presence of disease. The benefits of AI in medical imaging extend beyond simply improving diagnostic accuracy. AI algorithms can also automate time-consuming tasks, such as measuring tumor size, identifying areas of interest for biopsy, and generating preliminary reports, freeing up radiologists and pathologists to focus on more complex cases and interact more directly with patients. This not only enhances efficiency but also allows for faster turnaround times for results, leading to earlier diagnoses and potentially life-saving interventions. Furthermore, AI is not limited to static images. In the field of cardiology, for example, AI algorithms are being used to analyze echocardiograms, which use sound waves to create moving images of the heart, to detect subtle abnormalities in heart function that might not be apparent to the human eye. This is particularly valuable in diagnosing conditions like heart valve disease and heart failure, where early detection and intervention are critical for improving patient outcomes. The earlier a disease is detected, the better the chances of successful treatment and long-term survival. However, many diseases, particularly in their early stages, produce subtle changes that are difficult to detect with the naked eye, even for the most experienced clinicians. This is where AI's ability to discern subtle patterns and anomalies in medical images becomes truly transformative, enabling the early detection of diseases that might otherwise go unnoticed until they have progressed to a more advanced and difficult-to-treat stage. Consider the impact of AI in cancer screening. In mammography, AI algorithms are proving particularly adept at identifying early signs of breast cancer, even in dense breast tissue, that can make traditional mammograms difficult to interpret. Studies have shown that AI-assisted mammography can increase cancer detection rates while reducing the number of false positives, leading to earlier diagnoses and more timely treatment for women. AI is also making significant strides in the early detection of lung cancer, a leading cause of cancer deaths worldwide. AI algorithms can analyze low-dose CT scans, which are often used to screen for lung cancer in high-risk individuals, to identify suspicious nodules that might be too small or too subtle for the human eye to detect. This early detection can be life-saving, as it allows for earlier interventions, such as surgery or radiation therapy, when the chances of successful treatment are highest. Beyond cancer, AI is proving its worth in detecting a wide range of other diseases in their early stages, including diabetic retinopathy, a leading cause of blindness, and Alzheimer's disease, a debilitating neurodegenerative disorder. By enabling earlier diagnoses, AI is not only improving individual patient outcomes, but also has the potential to transform healthcare systems by shifting the focus from reactive treatment to proactive prevention and early intervention. Radiology, the branch of medicine that uses imaging techniques to diagnose and treat diseases, is undergoing a profound transformation, driven in large part by the rapid advancements in artificial intelligence. AI is not simply a new tool in the radiologist's arsenal. It is fundamentally reshaping the field, from streamlining workflows and improving efficiency to enhancing diagnostic accuracy and enabling new possibilities in personalized medicine. One of the most immediate impacts of AI in radiology is its ability to automate time-consuming and repetitive tasks. AI algorithms can now analyze medical images to identify areas of interest, measure tumor size, detect fractures, and generate preliminary reports, freeing up radiologists to focus on more complex cases, consult with referring physicians, and interact directly with patients. This not only improves the efficiency of radiology departments, but also allows radiologists to practice at the top of their licenses, focusing on tasks that require their unique expertise and judgment. More importantly, AI is enhancing the accuracy of radiological diagnoses. Studies have shown that AI algorithms, trained on vast datasets of medical images, can often achieve comparable or even superior accuracy to human radiologists in detecting a wide range of conditions, from pneumonia and lung nodules to bone fractures and brain bleeds. This is particularly valuable in situations where time is of the essence, such as in emergency departments or in underserved areas where access to specialized radiological expertise may be limited. Furthermore, AI is enabling new possibilities in personalized medicine by providing radiologists with more detailed and nuanced information about their patients. AI algorithms can analyze medical images in conjunction with other patient data, such as genetic information, medical history, and lifestyle factors, to provide a more comprehensive picture of a patient's health status and tailor treatment recommendations accordingly. This personalized approach to radiology has the potential to improve patient outcomes, reduce unnecessary procedures, and optimize the use of healthcare resources. The future of medicine lies in precision medicine, an approach that tailors medical treatments and interventions to the individual characteristics of each patient, taking into account their unique genetic makeup, lifestyle, and environmental factors. AI, with its ability to analyze vast amounts of data and identify complex patterns, is playing an increasingly vital role in realizing this vision, particularly in the realm of diagnostics. AI algorithms are now being used to develop personalized diagnostic tools that can predict an individual's risk of developing certain diseases, identify the most effective treatment options based on their unique genetic profile, and monitor their response to treatment in real time. This personalized approach to diagnostics moves away from the one-size-fits-all model of medicine, leading to more accurate diagnoses, more targeted treatments, and ultimately, better outcomes for patients. In oncology, for example, AI is being used to analyze the genetic makeup of tumors to identify specific mutations that are driving cancer growth. This information can then be used to select targeted therapies that are more likely to be effective against the patient's particular type of cancer, sparing them from the side effects of traditional chemotherapy drugs that may not be beneficial. AI is also being used to develop personalized imaging biomarkers, measurable indicators that can be extracted from medical images to provide insights into a patient's disease status, prognosis, and likely response to treatment. These biomarkers can help clinicians make more informed decisions about treatment strategies, monitor disease progression, and predict the likelihood of treatment success, paving the way for more personalized and effective health care. For centuries, the surgeon's skill has been measured by the steadiness of their hand, the precision of their movements, and the depth of their anatomical knowledge. Today, a new era of surgery is dawning, one where human expertise is augmented by the precision and control of robotic systems. Surgical robotics, once a futuristic concept, is now a reality in operating rooms around the world, transforming the surgical landscape and pushing the boundaries of what's possible in minimally invasive procedures. At the heart of this revolution lies the surgical robot, a sophisticated machine designed to assist surgeons in performing complex procedures with enhanced accuracy, dexterity, and control. These robots typically consist of multiple robotic arms equipped with specialized surgical instruments, a high-definition three-dimensional camera providing an immersive view of the surgical field, and a console where the surgeon sits and controls the robot's movements with remarkable precision. Unlike traditional open surgery, which often requires large incisions and can result in significant blood loss and lengthy recovery times, robotic surgery allows surgeons to operate through small incisions, minimizing trauma to the patient's body and reducing the risk of complications. This minimally invasive approach translates into less pain, shorter hospital stays, and faster recovery times for patients. While surgical robots are already transforming the surgical landscape, the integration of artificial intelligence promises to further enhance their capabilities and usher in a new era of precision surgery. AI algorithms, trained on vast datasets of surgical procedures, can analyze real-time data from the robot's sensors and cameras to provide surgeons with valuable insights, guidance, and even automate certain tasks during surgery. Minimally invasive surgery aims to minimize trauma by operating through small incisions. AI-guided robotics is a game-changer, enabling surgeons to perform delicate procedures with enhanced precision. Surgical robots, guided by AI, can filter out hand tremors, ensuring smooth movements. AI enhances a surgeon's perception with high-definition 3D cameras and real-time analysis. AI creates 3D models from preoperative scans, guiding surgeons along optimal paths. This is crucial for delicate organs like the brain or heart, minimizing risks. AI-guided robotics is pushing the boundaries of what's possible in surgery. AI in surgical robotics augments surgeon skills, creating a powerful collaboration. AI provides real-time guidance and decision support during surgery. AI alerts surgeons to potential complications, allowing prompt corrective action. Predictive models anticipate complications, enabling preventative measures. AI helps surgeons improve skills by analyzing past procedures. Personalized recommendations optimize surgical workflows. AI empowers surgeons to deliver optimal outcomes for patients. Could we see fully autonomous surgical robots? It's a topic of active research. Proponents argue these systems could perform procedures with greater precision. Benefits include access to specialized expertise in underserved areas. Ethical and safety concerns like accountability need addressing. Human elements like intuition and judgment are hard to replicate. AI and robotics will likely continue to augment human capabilities in surgery. Drug discovery is long, complex, and costly, often taking over a decade. AI is revolutionizing this process, accelerating drug discovery and reducing costs. Traditional methods rely on serendipity and trial and error. AI analyzes massive datasets to identify promising drug candidates. AI-powered virtual screening identifies compounds with high binding probability. AI analyzes clinical trial data to predict drug success or failure. This data-driven approach de-risks drug development and accelerates new medicines. Identifying the right target is crucial in drug discovery. AI enables a strategic approach to target identification and validation. AI analyzes vast data sets to uncover hidden correlations and patterns. AI assists in target validation, confirming relevance to the disease. This approach is faster and more efficient than traditional methods. AI uncovers novel drug targets for complex diseases. Finding a molecule that interacts with a target is a challenge. AI accelerates virtual screening and drug design. AI predicts compound binding likelihood faster and cheaper than traditional methods. AI designs novel drug candidates from scratch. Structure-based drug design creates specific and potent candidates. AI explores chemical space efficiently, identifying novel structures. AI expands the pool of potential drug candidates. Drug-resistant pathogens are a major global health threat. AI provides tools to combat drug resistance and develop new therapies. AI identifies resistance mutations and predicts new mechanisms. AI targets essential pathways in pathogens, minimizing resistance risk. AI repurposes existing drugs for new indications. AI accelerates development of new antibiotics and antivirals. AI helps outpace the evolution of drug resistance. AI in healthcare is about collaboration, not replacement. AI automates routine tasks, freeing doctors for patient care. AI-powered assistants handle administrative burdens. Doctors focus on empathy, compassion, and complex decision-making. AI analyzes vast data, providing comprehensive patient insights. Doctors make informed decisions based on AI insights. AI empowers doctors to enhance diagnostic accuracy and personalize treatment. AI enhances diagnostic accuracy and personalizes treatment plans. AI analyzes complex data sets for better diagnosis and management. AI generates potential diagnoses, helping avoid errors. AI predicts treatment responses based on patient data. Personalized medicine tailors treatments to individual needs. AI predicts patient outcomes, enabling proactive interventions. AI improves patient outcomes and reduces healthcare costs. The integration of AI into healthcare is often met with concerns about the potential loss of the human touch in medicine. However, rather than diminishing the importance of human connection in healthcare, AI has the potential to amplify it, freeing up clinicians from tedious tasks and allowing them to focus on what truly matters, building meaningful relationships with their patients, providing empathy and support, and delivering truly patient-centered care. Imagine a world where doctors have more time to sit down with their patients, listen attentively to their concerns, explain complex medical information in a way that is easy to understand, and answer their questions with patience and compassion. This is the promise of AI-powered healthcare, where technology takes on the burden of data analysis, administrative tasks, and even some aspects of diagnosis and treatment, allowing clinicians to focus on the human aspects of care that are essential for healing and well-being. AI can also empower patients to take a more active role in managing their own health. AI-powered mobile apps and wearable health trackers can provide patients with personalized insights into their health status, track their progress, and deliver tailored recommendations for improving their well-being. This can empower patients to make informed decisions about their health, leading to better adherence to treatment plans and improved long-term outcomes. The goal of AI in healthcare is not to replace human interaction, but to enhance it, creating a more collaborative and patient-centered approach to medicine where technology and human expertise work in harmony to deliver the best possible care for every individual. The integration of AI into healthcare holds immense promise, but it also raises important ethical considerations that must be carefully addressed to ensure that this powerful technology is used responsibly and equitably. As AI algorithms become more sophisticated and autonomous, it is crucial to establish clear ethical guidelines, foster open dialogue between stakeholders, and prioritize patient privacy, autonomy, and well-being above all else. One of the most pressing ethical concerns is the potential for bias in AI algorithms. If the data used to train these algorithms reflects existing biases in healthcare, such as racial or socioeconomic disparities, the resulting AI systems may perpetuate or even exacerbate these inequalities. It is essential to ensure that training datasets are diverse and representative of the populations they are intended to serve, and that algorithms are regularly audited for bias. Another important consideration is the issue of transparency and explainability. As AI algorithms become more complex, it can be difficult even for experts to understand how they arrive at their decisions. This lack of transparency can erode trust in AI systems and make it challenging to identify and correct errors or biases. Efforts are underway to develop more transparent and explainable AI models for healthcare, but much work remains to be done in this area. The future of healthcare lies in harnessing the power of AI while upholding the highest ethical standards. By fostering collaboration between clinicians, AI developers, ethicists, and policymakers, we can create a future where AI enhances human capabilities, improves patient outcomes, and promotes a more equitable and just healthcare system for all. The integration of artificial intelligence into the sensitive realm of healthcare is not without its ethical complexities. As algorithms increasingly influence medical decisions, a profound responsibility rests on the shoulders of developers, clinicians, and policymakers to ensure that these technologies are guided by ethical principles that prioritize patient well-being, autonomy, and trust. This necessitates a nuanced understanding of the potential benefits and risks of AI in healthcare and a commitment to establishing clear ethical guidelines that govern its development and deployment. One of the paramount ethical considerations is the potential for bias in AI algorithms. These algorithms learn from the data they are trained on, and if this data reflects existing biases in healthcare, such as racial or socioeconomic disparities, the resulting AI systems may perpetuate or even exacerbate these inequalities. Imagine an algorithm designed to predict the risk of heart disease that is trained on a dataset predominantly composed of data from white patients. Such an algorithm might not accurately predict risk in patients from other racial or ethnic backgrounds, potentially leading to misdiagnosis or inadequate treatment. Another critical ethical concern is the potential for AI to erode patient autonomy. As AI systems become more sophisticated, they may be used to make treatment recommendations or even automate certain medical decisions. While this can improve efficiency and reduce errors, it also raises concerns about who is ultimately responsible for medical decisions: the clinician, the AI developer, or the algorithm itself. Preserving patient autonomy requires ensuring that AI systems are used as tools to support, not supplant, clinical judgment, and that patients are fully informed about the role of AI in their care and empowered to make decisions that align with their values and preferences. Furthermore, the increasing reliance on AI in healthcare raises concerns about data privacy and security. AI algorithms require access to vast amounts of sensitive patient data to function effectively, and this data must be protected from unauthorized access, breaches, and misuse. Robust data encryption methods, secure storage systems, and strict access controls are essential to safeguard patient privacy and maintain trust in AI-driven healthcare systems. Trust is the cornerstone of the doctor-patient relationship, and in the age of AI-driven healthcare, transparency is paramount to building and maintaining that trust. Patients have a right to understand how AI algorithms are being used in their care, how these algorithms arrive at their conclusions, and what implications these conclusions might have for their health outcomes. This requires a shift towards explainable AI or XAI, which aims to make the decision-making processes of AI systems more transparent and understandable to human users. The challenge of explainable AI in healthcare is particularly acute given the complexity of many medical decisions and the high stakes involved. Imagine a patient diagnosed with cancer who is recommended a specific course of treatment based on an AI algorithm's analysis of their medical history and genetic profile. The patient has a right to understand how the algorithm arrived at this recommendation, what factors were considered, and what the potential benefits and risks of the recommended treatment are compared to other options. Explainable AI in healthcare is not just about providing patients with information. It's about empowering them to engage in shared decision-making with their healthcare providers. When patients understand the reasoning behind AI-driven recommendations, they can ask informed questions, express their concerns, and ultimately make decisions that align with their values and preferences. This collaborative approach fosters trust and ensures that AI is used to enhance, not undermine, the doctor-patient relationship. Transparency in AI-driven healthcare also extends beyond the individual patient level. Healthcare institutions, policymakers, and AI developers must be transparent about how AI algorithms are developed, trained, and validated, as well as how they are integrated into clinical workflows and decision-making processes. This openness can help identify and address potential biases, ensure that AI systems are used appropriately, and build public trust in the responsible use of AI in healthcare. The promise of artificial intelligence in healthcare hinges on the availability of vast amounts of data. AI algorithms thrive on data, using it to learn, adapt, and make increasingly accurate predictions. However, this insatiable appetite for data must be balanced against the paramount need to safeguard patient privacy and ensure that sensitive health information is handled with the utmost care and responsibility. Healthcare institutions, AI developers, and policymakers must work together to establish robust data governance frameworks that protect patient privacy while enabling the responsible use of data for AI development and deployment. One of the key challenges in protecting patient privacy in the age of AI is the sheer volume and complexity of data involved. Healthcare data is no longer confined to paper files locked away in filing cabinets. Electronic health records, medical images, genomic data, wearable sensor data, and even social media activity can all be integrated to create comprehensive patient profiles that offer valuable insights into health status, disease risk, and treatment response. However, this interconnectedness also creates new vulnerabilities and requires sophisticated data security measures to prevent unauthorized access, breaches, and misuse. De-identification, a process that removes or alters identifying information from patient data, is often touted as a solution for protecting privacy while enabling data sharing for AI development. However, de-identification is not foolproof, especially as AI algorithms become more adept at re-identifying individuals from seemingly anonymous datasets. Techniques such as differential privacy, which adds carefully calculated noise to datasets to protect individual privacy while preserving the overall statistical properties of the data, offer a promising avenue for enabling data sharing for AI development without compromising patient confidentiality. Ultimately, safeguarding patient privacy in the age of AI requires a multifaceted approach that includes robust data governance frameworks, sophisticated data security measures, and ongoing dialogue between stakeholders to address emerging challenges and ensure that patients' rights and trust are paramount. Amidst the excitement and anticipation surrounding AI's transformative potential in healthcare, it is crucial to remember that medicine is, at its core, a deeply human endeavor. The essence of healing lies not just in treating diseases, but in caring for individuals, understanding their fears and hopes, and providing empathy and support alongside clinical expertise. As AI algorithms increasingly influence medical decisions, it is essential to preserve the human element of healthcare, ensuring that technology complements, not replaces, the irreplaceable human connection between doctor and patient. One of the concerns often voiced about AI in healthcare is the potential for dehumanization. Will patients feel like just another data point in an algorithm's calculation, their individual stories and experiences lost in a sea of numbers? This concern highlights the importance of ensuring that AI is used to enhance, not replace, the doctor-patient relationship. Clinicians must be trained to use AI tools effectively while maintaining their focus on the patient as a whole person, understanding their values, beliefs, and preferences. AI can, in fact, free up clinicians from tedious tasks and administrative burdens, allowing them to spend more time with their patients, listening attentively, answering questions, and providing emotional support. This shift from data entry to data interpretation and from task-oriented care to relationship-centered care can enhance empathy and build stronger bonds between doctors and patients. The future of healthcare hinges not on a choice between human doctors and AI algorithms, but on a collaborative approach that leverages the strengths of both. By embracing AI as a powerful tool while preserving the human element of medicine, we can create a healthcare system that is not only more efficient and effective, but also more compassionate, personalized, and centered on the needs and values of each individual patient. As we stand on the cusp of 2025, the question is no longer whether artificial intelligence will reshape healthcare, but how profoundly it will do so. The evidence is irrefutable. AI is already making its mark, from automating mundane tasks to assisting in complex surgeries, from identifying promising drug candidates to predicting disease outbreaks. However, the true revolution lies not in replacing human clinicians, but in augmenting their capabilities, creating a future where human expertise and artificial intelligence work in seamless concert. Imagine a world where doctors are freed from the shackles of data entry, their time no longer consumed by administrative burdens or the tedious analysis of countless medical images. AI-powered virtual assistants, working tirelessly in the background, can handle these tasks with speed and accuracy, providing clinicians with synthesized insights and freeing them to focus on what truly matters: the patient sitting before them. This shift from data entry to data interpretation allows doctors to practice at the top of their licenses, leveraging their years of training, experience, and honed intuition to make informed decisions guided by the insights provided by AI. The operating room of the future will transform into a symphony of human and artificial intelligence, each playing a crucial role in orchestrating successful surgical outcomes. Surgeons, no longer limited by the constraints of human vision or the subtle tremors of even the steadiest hand, will wield AI-guided robotic instruments with unparalleled precision, performing minimally invasive procedures with greater accuracy and control. Meanwhile, AI algorithms, analyzing real-time data from the surgical field, will provide surgeons with a constant stream of insights, alerting them to potential complications before they arise and guiding their decisions with data-driven recommendations. The traditional walls of hospitals and clinics will crumble as AI-powered telehealth platforms extend the reach of healthcare to even the most remote corners of the globe. Patients, armed with smartphones and wearable health trackers, will have access to personalized health insights and virtual consultations with healthcare providers, regardless of their location. Chronic diseases will be managed proactively, with AI algorithms analyzing real-time data from wearable sensors to detect early signs of deterioration and alert clinicians to intervene before a crisis arises. The road ahead is not without its challenges. As we venture further into the uncharted territory of AI-driven healthcare, we must proceed with caution, guided by ethical principles that prioritize patient well-being, autonomy, and trust. The algorithms we create are only as good as the data we feed them, and we must be vigilant in addressing potential biases that could perpetuate or even exacerbate existing health disparities. Transparency and explainability will be paramount in building trust in AI-driven healthcare systems. Patients deserve to understand how AI algorithms are being used in their care, how these algorithms arrive at their conclusions, and what implications these conclusions might have for their health outcomes. Black box algorithms, their inner workings shrouded in secrecy, will breed suspicion and distrust. We must strive to develop AI systems that are not only accurate, but also interpretable, allowing clinicians and patients to understand the reasoning behind AI-driven recommendations and engage in shared decision-making with confidence. The protection of patient privacy must be woven into the very fabric of AI-driven healthcare systems. As we gather ever-increasing amounts of data to fuel the algorithms that power personalized medicine, we must be unwavering in our commitment to safeguarding this sensitive information. Robust data encryption methods, secure storage systems, and strict access controls will be essential to prevent data breaches and maintain patient trust. The future of healthcare hinges on our ability to harness the transformative power of AI while upholding the highest ethical standards. This is not a task for technologists alone, but a shared responsibility that demands collaboration between clinicians, AI developers, ethicists, policymakers, and the public. By working together, we can create a future where AI empowers healthcare professionals to deliver more effective, compassionate, and human-centered care, ushering in a new era of augmented healthcare that benefits all. As we stand on the precipice of a new era in healthcare, the journey ahead is both exciting and daunting. The fusion of artificial intelligence with medicine holds the potential to revolutionize the way we approach health and wellness, making it more personalized, efficient, and accessible. Yet this transformation will only be possible through a collective effort that emphasizes ethical considerations, transparency, and patient-centric care. The vision for the future is one where AI augments the capabilities of healthcare professionals, enabling them to make more informed decisions, perform precise interventions, and provide tailored treatments. Imagine a world where diseases are detected in their earliest stages, treatments are customized to the unique genetic makeup of each patient, and healthcare is accessible to all, regardless of geographic location. This future is within our grasp, but it requires a concerted effort to address the challenges that lie ahead. We must ensure that the AI systems we develop are transparent, interpretable, and free from bias. We must protect patient privacy with the utmost diligence and foster a culture of trust and collaboration among all stakeholders. By embracing these principles, we can pave the way for a healthcare system that is not only technologically advanced, but also deeply human. A system where AI serves as a powerful ally in our quest for better health, and where the well-being of patients remains at the heart of everything we do. Please subscribe to our channel, like this video, and hit the bell button to stay updated with our latest content. Together, we can explore the boundless possibilities of AI in healthcare and work towards a brighter, healthier future for all.